Hello, Nursing 505 Healthcare System and Health Policy. My name is Daniel Singh. I will be providing a presentation on the Heart of Maryland under the American Military University under Professor Amy Stafford. Our learning objectives will include identifying the problem, interventions for the problem. I will cover 3 policies that can help promote the identified problem and provide solutions. And then we will discuss one of the 3 proposed policies that are best recommended to support and combat the problem itself, why it is the best choice for healthcare clinicians, as well as the selling point, finally, that would establish it as a priority issue for advocacy and health policy development. And then I will also provide the references at the end. As the title indicated, the Heart of Maryland. The problem in Maryland, the number one problem is heart disease. The term heart disease refers to any condition that affects the blood flow to the heart. Atherosclerosis, thickening or hardening of the arteries, is caused by a buildup of plaque in the inner lining of an artery. As you can see in an image, normal artery on the left, comparatively to the image on the right, with an artery that has plaque buildup, which will narrow the blood vessels and prevent proper blood flow. According to Maryland Department of Health, heart disease and stroke are the number 1 and number 3 causes of death in Maryland, respectively. A study done by American Health Rankings utilized data from the CDC Behavioral Risk Factor Surveillance System back in 2022, which indicated cardiovascular disease by state. The percentage of adults who reported or ever being told by a healthcare professional that they had angina or coronary heart disease, a heart attack, or myocardial infarction or a stroke. As you can see in the map of the nation, Utah ranked number 1, which is comparatively to West Virginia. Utah, it was actually better, so there's less individuals identifying some sort of cardiovascular disease, where West Virginia had 14.8% of individuals who had indicated they had some sort of cardiovascular disease. Cardiovascular disease in Maryland ranked within that same ranking system as number 6. So it isn't it isn't as close to West Virginia per se. It does rank 6, and it's only in the 8% comparatively to 14.6 in West Virginia. But Maryland's number 1 leading cause of death is cardiovascular disease. This is why our primary focus will be on cardiovascular disease comparatively to our state. Coronary heart disease treatment can comprise of 3 different topics that we will cover: heart healthy lifestyle change, medicines, and in the next slide we'll cover surgical intervention. But going into heart healthy lifestyle changes, heart healthy foods such as fruits, vegetables, and whole grains, and limit saturated fats, sodium intake, added sugars, and alcohol are some of the dietary options to improve a healthy heart. Also, recommendations for those lifestyle changes are to be more physically active. You always want to consult your provider should you have any pre-symptoms of cardiovascular disease, at what level of physical activity is right for you. It is highly encouraged to quit smoking, get adequate amount of sleep. Sleep is very direct correlation to heart health, and managing your sleep is a combination of also helps managing your stress. So they are almost intertwined, but managing your stress is also a direct impact on heart health. Now, a secondary form of treatment is medicines. As part of your treatment plan, your provider may prescribe you medicines that widen your blood vessels and help your heart beat with less force. They may also prescribe medicines to help manage the levels of cholesterol that we mentioned in that previous image of blood vessels narrowing due to plaque. The medicines manage cholesterol can help prevent the buildup of plaque within those arteries. Some medicines can help manage other risk factors of heart disease, such as high blood sugar, overweight, obesity, and diabetes, which can in turn help with giving you the ability and options to be more physically active. Now, the third intervention is surgical intervention. Now, patients are generally not, this is not the first form of treatment. You would like to start with a healthy lifestyle, healthy heart lifestyle, but surgical intervention is an option. You may need a procedure or heart surgery to treat coronary heart disease that is more serious. Some of those options can be percutaneous coronary intervention, opens the coronary arteries, usually using some sort of a stent to keep those blood vessels open to get the blood to flow. There's coronary artery bypass grafting, also known as CABG, by using healthy arteries from different places like your chest wall, veins from your legs, and to have them transplanted to basically providing a new road for traffic to flow through, traffic being your blood vessels or blood cells. And then there's also transmyocardial laser revascularization or coronary endocardectomy when other treatments are too risky or do not work. That's when you would utilize this particular method. And then there's also bariatric surgery, which is another surgical intervention that can help overall tackle heart disease. So now that we've identified the problem, let's go through 3 potential policy changes that can help combat heart disease, not only in the nation, but specifically in Maryland. One of the policy suggestions or policy reforms is to bring physical activity implementation back to the school system, and instead of an elective, be encouraged as a mandatory course throughout K through 12, all the way up to the 12th grade. The second policy is utilization of healthcare technology features, which can become a verification of physical activity for insurance companies for patients who are striving to seek their own personal health improvements, and in return receive discounts in health insurance throughout the year for it. The third policy reform will provide for all 65 and older within that senior age group physical recreation center memberships such as YMCA, the Young Men's Christian Association, for free of no charge or obligation. The current state of the program is not open to all 65 and older. There are additional parameters that must be met to qualify for free, quote unquote, free physical fitness membership, such as Medicare C and D. Of the 3 policies provided in the previous slide, the proposed policy recommended for support would be to have K through 12 physical education be a mandatory course throughout all age life cycles from K to the entire 12. So what is the current program in Maryland? Per Maryland State Department of Education, the physical education framework for K through 12 covers various skills/concepts to be assessed at grade level milestones up to 8th grade. Then they deviate to meeting a skill level 1 and 2 requirement achieved 9 through 12. If they meet those parameters, they are not mandated to take courses every year from 9 through 12, those 4 years. Physical education is not a mandatory class per year at the high school level. So why it is the best choice for healthcare clinicians to support? Well, one of the leading medical universities in the nation and hospitals, Johns Hopkins, which happens to be in Maryland, defines exercise the best method to treat heart disease. It lowers blood pressure, lessens risk of developing diabetes, maintains healthy body weight, reduces inflammation throughout the entire body. It improves muscle ability to pull oxygen out of the blood, reducing the need to heart for pump more blood to the muscles. It reduces stress hormone. And also, it works like a beta blocker to slow down the heart rate and lower blood pressure. And as we mentioned earlier about healthy lifestyles, what exercise provides is meeting those precursors before heart disease can even become a problem. So it brings us to the selling point, the priority of why this particular policy should be advocated for. So according to the CDC, consequences of physical inactivity can lead to energy imbalance and can increase the risk of becoming overweight or obese. Also, it can increase the risk factors of cardiovascular disease, including hyperlipidemia, cholesterol, increasing high levels of triglyceride, high blood pressure, obesity, and insulin resistance and glucose intolerance. Things that we are trying to avoid, which directly have a correlation to heart disease. Now, physical activity barriers of young people, and the additional factors that CDC provided is less than 1/4 of children 6 to 17 years of age participate in 60 minutes of physical activity every day. In 2017, nearly half of the high school students attended physical education classes in an average week. Only 29, give or take 30% of high school students attended physical education class daily. Furthermore, the benefits of regular physical activity can help children and adolescents improve cardiorespiratory fitness, build stronger bones and muscles, control weight, reduce symptoms of anxiety and depression, and reduce the risk of developing heart condition, which we see in the following: heart disease, cancer, diabetes, high blood pressure. All those can be prevented before heart disease becomes a problem. In addition, the CDC mentions that students who are physically active tend to have better grades, school attendance, cognitive performance, and classroom behavior. Higher physical activity and physical fitness level are associated with improved cognitive performance among students. So, although people might say that it takes more time away from school or education, on the contrary, physical activity helps improve brain function to do well in school, as well as mood and physical health of the individuals as well. Which brings me to my closing remarks. Bring physical education back from K through 12th grade at all grade levels as mandatory course. Physical activity is the key to combat heart disease. It should not be if the physical individuals have the understanding of the concepts, such as recognize the value of physical activity. It should be get those hearts moving. Thank you. That concludes my presentation.